I have friends and colleagues in Gaza, as you've mentioned, our colleagues working in the charity sector, their own staff are starving now, are unable to find anything to eat. I have friends and colleagues who in the last 3 or 4 days have sent me messages saying things to the effect of, we would rather be killed by an Israeli airstrike than slowly starved to death as a result of Israel's intentional blockade of food and water. I mean, this is just the most barbaric of situations.
100 charities and humanitarian organizations have joined together to make an urgent plea to allow life-saving aid into Gaza because reports are emerging of deaths from severe malnutrition. The agency's statement says that they are, quote, witnessing their own colleagues and partners waste away before their eyes. Israel, which controls Gaza's borders, rejects the charge that it's using hunger as a weapon of war. It says there were 950 trucks worth of aid waiting in Gaza for international organizations to pick up and distribute. Well, let's speak to Dr. James Smith, an emergency physician who worked for 2.5 months inside Gaza. He's a lecturer in humanitarian studies at UCL in London. Dr. Smith, I know you keep very close eye on what is happening in Gaza now. How bad is the hunger, the malnutrition situation in your view?
Thanks, Stephen. I mean, this is really a cataclysmic stage in the genocide now. More than 100 people have died as a result of severe malnutrition. Now, that is most likely a dramatic underestimation. The other thing, of course, that you need to bear in mind is that malnutrition itself is rarely the primary cause of death. It's typically a constellation of profound undernutrition, in this case, manufactured starvation, in combination with the spread of respiratory diseases, diarrheal diseases, and so on, which we know are also in wide circulation in Gaza now as a result of extreme overcrowding in abject conditions, Israel's destruction of water and sanitation infrastructure, and so on, which together has created this perfect genocidal storm for mass death. I have friends and colleagues in Gaza, as you've mentioned, our colleagues working in the charity sector, their own staff are starving now, are unable to find anything to eat. I have friends and colleagues who in the last 3 or 4 days have sent me messages saying things to the effect of, we would rather be killed by an Israeli airstrike than slowly starved to death as a result of Israel's intentional blockade of food and water. I mean, this is just the most barbaric of situations.
Israel, of course, absolutely denies the charge of genocide that you've laid at their door, but I don't want to get stuck on that. I do want you, with your doctor's experience in Gaza, to tell me, you know, just how close to impossible conditions are becoming for healthcare workers in Gaza's few remaining hospitals that are able to work. You know, the doctors themselves are clearly hugely hungry now, and the conditions are appalling anyway. So just how difficult is it becoming?
If I may, Stephen, just before I answer that question, I do obviously want to respect what you're saying there. But, you know, Israel continues to refute all of the allegations that have been leveled against it. I think, you know, the decent thing to do from a journalistic point of view is at the very least to mention all of those entities that do believe that Israel is committing genocide. And there are a long list, a growing list of genocide experts, UN independent experts, Médecins Sans Frontières, Amnesty International, several states.
Honestly, Dr. Smith, I did discuss this in some detail with an Israeli commentator yesterday, and I did point out that some of those who are now saying that genocide may well be legally applicable are voices from Jewish academics, actually, in the United States and elsewhere. So we have had that discussion on Times at One very recently, but I want to tap into your knowledge of doctoring in Gaza today and just how close to impossible the situation is becoming.
Absolutely. Let me get to that question. I mean, the conditions in the hospitals have been just disgraceful, really, for almost 2 years now, and disgraceful not by the efforts of Palestinian healthcare workers who are trying to do what they can with what limited resources remain available to them, but disgraceful because Israel has blocked the provision of essential medical supplies, has damaged solar panels and water systems. We were working over a year ago in some emergency rooms where we didn't have access to running water for staff to wash their hands. We ran out of paracetamol, gauze, saline, the most basic necessities, really, that are required to rehydrate a dehydrated individual or to clean a wound. And of course, that situation has only deteriorated precipitously. I've seen footage from friends and colleagues in the last 24 hours of several children with severe traumatic injuries, some of them dead on the floor with open abdominal wounds, the most horrific conditions for any healthcare worker to work in, and of course for any human being to be subjected to.
Just a very quick thought, if you would, on these Gaza Humanitarian Foundation aid hubs. There are, I believe, only 4 of them across Gaza to service 2 million people. It's an Israeli idea backed by a US private enterprise. It forces Palestinians to travel for miles to try and get vital assistance. They have to queue, and what we have seen over days and weeks is that, the IDF has opened fire in the vicinity of these crowds, and many, many people have been killed. In your view, is it possible to run a humanitarian assistance effort and cut out the United Nations, which of course used to provide the aid and assistance across the Gaza Strip?
The short answer is no, absolutely not. The UN system, and particularly UNRWA, has been systematically undermined by Israel as part of its strategy of control. The Gaza Humanitarian Foundation it's a profound misuse of the term humanitarian. They definitely are not adherent to the values and principles that are meant to define humanitarianism, foremost among them a commitment to humanity. People are being corralled into cages, literally. More than 1,000 Palestinians have been killed in and around these distribution sites, more than 6,000 injured. My understanding is that only one of those 4 sites is currently functional. And as you've mentioned, they're all in the south of Gaza, which effectively forces, it is a way of enacting ethnic cleansing, which of course is a crime under international law.
James Smith, forgive me for cutting you off there. It's been great to talk to you. Thank you for coming onto the Times at 1, but we must move on. Thank you very much indeed.